Osborne Medical's Rook Heel Float Boot is the ideal product for patients with cold-modeled feet, vasopressed patients, those who require offloading of the heel to prevent and/or treat heel ulcers, or patients with an existing arterial wound that need an increase in perfusion. The Rook Heel Float Boot also offers foot drop protection with the foot drop wings. Included, there is an anti-rotation wedge that can prevent either internal or external rotations. This video will provide step-by-step instructions on how to correctly put on the Rook Heel Float Boot and how to use various features of the boot. Have your patient in a supine position and their leg or legs accessible to you. Take the Rook Heel Float Boot and undo all of the hook and loop closures for the toe box and calf. Once the boot is open, place the patient's leg in the boot so the calf is resting comfortably and the heel is floating over the heel pocket. The plantar surface of the foot should be upright, and nothing should be touching the heel. Once the patient's leg and heel are in place, close the calf section of the boot. Be sure the calf feels secure but not overly tight. Check the heel again to be sure it is floating. Once the patient's foot is in place, close the toe box of the boot by bringing down the tongue so the fleece is just short of the toes. Do not tuck the tongue into the body of the boot, as this could cause irritation to the patient. Close the side toe flaps over the tongue so the foot is secure but not too tight. For patients who need foot drop protection, adjust the wings to accommodate any existing tone. Be sure the patient still has a range of motion as you pull the wings up with just enough retraction to accommodate their condition. Do not pull too hard. The Rook Heel Float Boot can accommodate any foot from a woman's size 6 up to a men's size 16 by simply adjusting the toe box to the exact size and shape of the foot. If the patient has a large limb or foot that is not comfortably fitting in the Rook Heel Float Boot, open the strap package and utilize the extenders. These can be used on both the toe box and calf of the boot to provide extra girth and allow the boot to close more comfortably. You will note that the Rook Heel Float Boot comes with pre-cut slits for SCD tubes or vac lines. The Rook Heel Float Boot does have non-skid and padded sole to allow for patient ambulation. If your patient requires either internal or external rotation prevention, you may use the Rook Anti-Rotation Wedge with the Rook Heel Float Boot. Open the wedge and locate the strip of hook and loop material on both the boot and the wedge, and then attach the wedge to the boot with the hook and loop material. Next, bring the strap under and around the boot and attach securely. The wedge may be used laterally or medially, depending on what type of rotation you are addressing. The wedge then does an excellent job of resisting patient rotation and greatly assists in protecting the contralateral limb. For further information, questions, or to set up an in-service, please contact Osborne Medical at www.osbornemedical.com or 800-535-5865.